talk of the town. We are at Coastal Care Partners for their ribbon cutting of their new location with the founder, Scott Pierce.
Yes, thank you.
Congratulations.
Thanks,
a great
Robyn.
day.
It is. Excited to be here, Robyn. You know, this has been a dream of my wife, Amy, and I, who founded Coastal Care Partners. We started in Savannah.
Yes.
We wanted to come over to the Bluffton area because I'm from Savannah. This has always been a big part of my life, traveling over here. It's such a beautiful area. The growth has been so strong. We said it just makes sense for us to take our model of aging care over to the Bluffton area.
And you're in the back door of Sun City, which
Yes.
is also a great location.
It is.
With thousands of homes there. And the need is great.
Yeah, it is.
The need continues to be great as we all age. And your model of care is very unique. It's very integrated. You want to explain?
Yeah, so when Amy and I started the program, Amy's a registered nurse, and we both saw the need for the ability to hire people outside of the typical insurance model of healthcare, right? Because insurance and your primary care practice, there's really not a channel for someone to give you advice on the care that you need as you age, right? And so we said, why don't we create a business where you can hire a registered nurse to act as your care navigator, your private care manager. And so these nurses get very involved with their patients. They learn their family, they learn their needs, they learn their medical conditions, and then we can layer on top of it in-home care to help if they need a little help in the home during the day. And then we also have a medical arm as well. So you can sort of get all three of your needs, your advocacy, your in-home care, as far as your medical, and this all can be private paid because it allows you to do what you want to do and not be held at what insurance tells you to do, but you can pay for your needs.
You know, and there are a lot of folks that are here in the Lowcountry that have parents that are other places.
Yes.
And they're aging in place and they want to stay home, and to have a company like this that you can call that can navigate.
Yes.
That navigation's so complex and so difficult. So what a beautiful thing that you're doing.
And it's in our name, partners.
Yeah.
We're your partner in aging care. So you need someone to help you advocate and to manage your loved one's care, and we're your partner in that.
Very good. We're going to talk with your medical director in just a second.
Thanks, Robyn.
Thank you, Scott. Dr. Sanjay Iyer is the medical director here at Coastal Care Partners. Nice to meet you. You're based out of Savannah, is that correct?
That's right. Nat, pleasure to be with you today. Yes, we are based at our headquarters is in Savannah.
And so you kind of have a dual role. You actually work for Savannah, the hospital there in emergency medicine, and then you're medical director here. So what's your role?
That's right. So I serve as the Chief Medical Officer of Coastal Care Partners. I am a full-time emergency physician at Savannah at Memorial Hospital, and I have the pleasure of leading all of our medical initiatives, having medical oversight of our caregivers, of our nurse care managers, and of our concierge medical program as well in Savannah.
So what do you think about this model of caregiving as folks want to age in place? What do you think, Dr. Iyer?
Absolutely. Well, it's fabulous. I mean, it's getting harder and harder to navigate the healthcare system. It's very complex, it's confusing, and especially as we get older. So a lot of the things our caregivers and our nurse care managers do is help our patients, help our members navigate the healthcare system by taking them to appointments, managing their medications, preventing errors, and even preventing unnecessary hospitalizations as much as possible. We found that by keeping people out of the hospital, we can keep them healthier and we can keep them at home longer, which is really one of our priorities.
So here at Coastal Care Partners, would one of the nurses call you like for advice or consultation? Do you actually see patients that would be partners here?
Good question. So I don't personally see patients. We do have a concierge physician in Savannah, and we're hoping to open a concierge medical practice here in Bluffton as well in the near future. But yes, they do frequently call me for questions, guidance, and advice on how to best help their clients navigate a certain issue they're having. And like I said, our goal is to kind of keep them out of the hospital as long as we can.
So in closing, you have a full-time job already, but this is important to you. This is, I feel it in your your heart and your soul that this type of caregiving is important.
That's right, it is. And geriatrics has always been very near and dear to my heart. I've also served as a hospice physician. So I take a lot of pride in what we do here at Coastal Care Partners, as does the whole team. We try to deliver the best for our patients and our members.
Thank you, Dr. Iyer. Appreciate it.
My pleasure. Thank you.